In 2020, during a global healthcare crisis, the People's United Party came to power. The COVID-19 pandemic had caused widespread devastation, and the PUP promised to make strategic changes to Belize's healthcare system to ensure that all Belizeans have access to essential medical care.
And as such, we respect the decision of the Belizean people. As of today, we are no longer PUP standard bearers, but we are representatives of the people. We are a government of the people of Belize. And I want to assure everyone that we are going to be an open, accountable, transparent, and accessible government for the people of Belize.
In their Plan Belize manifesto, the PUP promised to set up a Public Health Emergency Response Commission to study COVID-19's impact on Belize and recommend better ways to handle future medical crises. The government quickly secured vaccines and received millions of dollars in equipment donations from foreign allies. They also put strict regulations in place to slow the spread of the virus.
The curfew remains from 9 p.m. to 4 a.m. Restaurants, saloons, diners, and other similar establishments are allowed to operate. They may offer dining-in services by reservations only, but for no more than 50% of the seating capacity and for fully vaccinated persons only. Restaurants that have proper ventilation, or a restaurant that is an open-air restaurant or an outdoor restaurant or an al fresco dining restaurant that is allowed to operate may offer dining-in services by reservation only for no more than 75% of its seating capacity, with fully vaccinated persons only.
The manifesto also promised to appoint a wellness minister to lead a national campaign for healthier living. Initially, the Briceno administration chose Michelle Shabat as Minister of Health and Wellness. However, things got chaotic when the ministry's CEO, Dr. Daisy Mendez, left after just 1 year. As the ministry struggled to find a suitable replacement, Prime Minister John Briceno replaced Shabat with Kevin Bernard as the new health minister.
When he took it over when the pandemic was at its worst, and the ministry had absolutely no plan. And so he took that on and rolled his sleeves and he worked hard day in, day out. Could he have done certain things? But of course, we could always look back, as we say now, looking back, you have 2020 vision. But I want to put on record again my appreciation for the tremendous work that Minister Misha Shabat did during this very, very, very difficult time.
Every year, non-communicable diseases, NCDs, like diabetes and hypertension, remain the leading cause of death in Belize. The PUP has promised to improve care for these diseases and work with the Ministry of Education to fully introduce health education in schools to prevent NCDs. In 2023, the ministry launched the Healthy Habits, Healthy Schools, Healthy Belize project, which provides healthier meals to students and cuts down on sugary drinks. The following year, Belize joined the Hearts Initiative to fight cardiovascular diseases in the region. The ministry has also successfully rolled out the National Health Insurance, NHI, to provide affordable healthcare services to Belizeans nationwide.
As you are aware, the rollout of the entire Cayo district has commenced. There have been consultations that is taking place. The plan is that by the end of this year, we should have NHI across the entire country. So there is a process. I think that in May, we are looking at targeting the Cayo side and then Belmopan district, Belmopan city, and then we go on to the other surrounding villages because the Cayo district is very huge. And so there's going to be a lot of uptake. It is our hope that by the end of the year, as I said, we would have full coverage of NHI across the entire country.
The government also planned to support the development of the medical science facility at the University of Belize. However, in 2024, they faced backlash for deciding to spend millions on land for a university hospital, even though the university had offered free land for the project.
I would not be able to speak on the cost of the land. That is something that is arranged through the Ministry of Economic Development, because that's where the decision for that was done. However, there was other challenges. The location of accessibility. Remember, it's not only a teaching hospital, but it's going to be a tertiary facility where you need to have immediate access. And so they felt, after the ministry and other technical team looked at it, they felt that it needed to be at a different location that is more accessible. But it will continue to serve, as Dean Johnson mentioned, not just the tertiary teaching hospital, but we also want to try and look at how we could implement our regional facilities to also become some level of teaching facilities where people can go in and learn clinical works and so forth. So, but yes, the decision was made to build a hospital at a different location. We are almost finished with the designs now, and I am hoping that we can break ground on that new facility by the end of this year.
The government has expanded healthcare services across Belize by opening the Placencia Polyclinic and building the San Pedro and Kikaker Hospital. They've also made several updates to health posts in rural villages, especially in southern Belize. Britney Gordon for News 5.